1 in every 65 children is diagnosed with an autism spectrum disorder. It's a 30% rise from 2012, which is just 2 years, according to a Time magazine article. If you've ever been sitting at a restaurant or in a grocery store and you've heard a screaming child and thought, why doesn't their parent do something? There's a 1 in 65% chance that you're complaining about a child with a disability. I have a 3-year-old daughter with autism myself. She's been diagnosed for almost 2 years. I have been to every doctor you can imagine to talk about it, and we've gotten a lot of good information from a lot of good people. With the rising rates of autism, it's important to understand and recognize behaviors of autism, as well as to understand that there are certain risk factors for having a child with autism yourself. Autism is an extremely prevalent neurodevelopmental disorder. It can be benign or it can be debilitating.
Got some radio?
The symptoms of autism can be subtle to severe and include social ineptitude, communication difficulties, among other strange habits that these children may have. There's no known cure for autism, but there are certain risks correlated with having a child with autism. It's necessary to know what autism is and how it's identified to truly understand how to recognize the disorder. Autism is a neurodevelopment disorder that has several distinct characteristics, which include social ineptitude, communication limitations, and developmental delays. Children with autism don't play pretend. You know, when you were a kid, you used to play house, or you would play any of those pretend games, sit in a box and pretend you were in a rocket ship. Children with autism lack the ability to do this. Another hallmark of autism is repetitive behavior, such as spinning and rocking back and forth. While it's not easy to see some of the more subtle symptoms of autism, the more obvious ones are sometimes debilitating. Communication difficulties are very common in children with autism. They have low social intelligence and they don't understand idioms and non-literal speech. They also have communication delays. A lot don't ever talk, and most don't have any receptive language. Therefore, they don't listen to commands in emergency situations, and they won't respond to their names when they're called. Another area of concern is cognition. Many children with autism have a lower IQ than their neurotypical developing counterparts. According to research studies done by universities, children with autism have peculiar and atypical play habits. They partake in repetitive and ritualistic play, lack of imagination, and do not interact socially with their peers. Autism is a struggle for individuals and parents alike. Everyone seeks answers to why this happens. Though there's no answer, nor is there a cure, there are several risk factors that may be involved in having a child with autism. The most compelling causes are maternal causes, such as vitamin deficiencies during pregnancy. Genetics have been shown in many studies to have a lot to do with autism. 10% of children with autism present with genetic deletions, which is deletions in certain strands of DNA. Statistically, a mother with advanced maternal age, which is greater than 35, is more likely to have children with disabilities, to include Down syndrome and other genetic disabilities, because the ovum aren't as developed as you get older. Prenatal fetal risks for autism should be considered when looking at risk factors. Premature birth is twice as prevalent in autistic children. Fetal hypoxia or low oxygen can cause autism by starving the brain for oxygen during neurological development. Medical interventions during birth, such as epidurals, manual extraction with forceps and vacuums, as well as Pitocin to induce labor, can also cause autism. There are a few indicators in infancy of autism that are quite common. So just because your child exhibits these behaviors does not mean they will be autistic. One is colic or extreme fussiness and crying as a child. Another is feeding issues in infancy, such as having problems breastfeeding, undereating, or overeating. And the last is slow socialization development. By this we mean slow to smile, slow to make eye contact, and slow to do other things. There's always more information to be shared and more to be learned, but starting with the basic opens the door for much better understanding. Autism is a general term for a spectrum of disorders that affects the operation of the brain and socialization of children. The symptoms range from debilitating to benign. They can usually be recognized by various typical hallmark symptoms, some being social development problems, unimaginative play, as well as communication issues. Risk factors and infantile indicators can predict a diagnosis, but there is no way to cure autism. In opening the speech, I mentioned my daughter has autism. I watch her struggle every day with things that should be easy for her. If nothing else comes from awareness, I hope that she grows up in a world that understands her more than disapproves of her behaviors. Thank you. You can stop. You can just